Thank you, Mary. I'm so happy to be here, and I'm honored to be here. I started my career working in childhood obesity longitudinal studies, as Mary said, and eventually during the obesity epidemic, when everything was going crazy, I decided to move into working with communities. So I started a center at Berkeley, and what I learned when I really listened to the communities is they wanted people to help with their questions. They weren't really as interested in our research. And so I ended up doing what a very famous professor at Duke, Kelly Brownell, taught me, is strategic science. So much of what I'll be showing you today is kind of based on strategic science. I work in community nutrition policy work, and I work a lot with schools and childcare, but I'm not going to cover those because they're already covered. So I'm going to cover today some other areas, and I'm going to be using a population approach and in a variety of settings. And the way I've carved out the talk today is I'm going to just share with you 4 examples of effective community nutrition interventions, because there's so many examples, and we do a lot of things to improve people's lives and to create more equity, but there aren't so many things that really have results. So I decided to scan the literature and do my best at trying to pull out what I felt were the 4 most efficacious community nutrition strategies. So the first is one that is exemplified by the study Shape Up Somerville. It's a multi-component program in a community that almost took a shotgun approach and did everything. It worked in schools, and it worked at work sites, and it worked with parks, and it changed, community policies. It created new policies. It had, community gatherings and all kinds of activities in the community, buy-in from the mayor and the council, and it was really an intensive time and resource, a study with lots and lots of activities. I mean, it's hard to even list them all. If you can think of intervention strategies, they probably tried it. They changed the school foods. They really worked on all levels with institutions and changing the environment and all the things that Mary had told us about, with the PSE strategies. And they did effectively, lower the BMI in children. So that's one strategy, is working intensely with a community, doing all the things. You won't know exactly what made the biggest difference. That's the downside of it, because you're putting your heart into the whole program. So that was my first example. That's a short one. Now I have 3 more examples that are going to be a little bit longer. And those are working on food purchasing in the retail environment to change population nutrition, improving access to healthy and decreasing access to less healthy foods and beverages in food programs, and reducing access to less healthy foods and beverages through the use of economic means or taxation. So each of those in its own way is very efficacious. So let's start with the retail. We did a review of literature at the institute where I work, the Nutrition Policy Institute, and came up with 3 primary areas that retail interventions can be divided into: price interventions, food access interventions, and store-based interventions. So let me go right to the store-based interventions. And I'm going to show you an example of an intervention that has been done recently that has been shown to be effective. And I think that it covers a lot of the principles if you're going to do a retail intervention that can make it effective. So this was in an urban swamp, as they call it. It was in the Tenderloin district of San Francisco, very rundown area. And it started with youth, and this is a really good way to start. The youth in the neighborhood did a mapping of foods and food access and the different opportunities. So the youth engaged the other community members, and the other community members engaged the policymakers. So, and then they worked together with a professor, a colleague at UC Berkeley, who's an expert in community-based participatory methods. So this was a very lengthy effort to get the community fully involved in what it is they would do differently with the old, rundown, awful stores in their neighborhood. So there was lots that could be done, but they needed to prioritize and figure out what the stores were doing wrong. And then they needed to engage the storekeepers. So they had the expertise at the university. She managed to get a nice NIH grant, which provided some good starting funding. Starting funding is very important if you're really going to work on store conversions like this. And then she engaged the local public health department, the leadership. And they figured out a way that the public health department could begin to support the kinds of things that they'd already started. And in the end, they actually passed legislation in the city for this particular program of renovating these old rundown stores. But they wrote into it procedures for how they're supposed to run, accountability, standards, monitoring. So this is going on right now, so in another 5 years, we'll see if this was sustainable, but this is potentially going to be a sustainable retail intervention, and they've already shown a difference in the food purchasing behaviors of the residents. So they've already hit the mark on being successful, and now it's really a matter of whether it continues. So this was the market before. It was called the Friendly Liquor Market. They took that word out, and it's now the Friendly Market. But you could see where the initial investment went. It went in to really beautify the store, and the limited amount of health department funding that's going to be coming their way, I suspect some of it is from SNAP-Ed, but I don't know what other sources the local public health department had. But it is going to be encouraging that fresh, healthy vegetable and healthy foods section of the store, because the storekeeper said that wasn't as cost effective as selling liquor and tobacco. So, they're trying to equalize that a bit. And they put the liquor and the alcohol and the tobacco in the bag. So that, some of the principles of it are partnerships and, all of the things I mentioned. I forgot to put youth on this, but I do think that is really a wonderful addition to the work in the retail sector, is to get the youth in the neighborhood involved, because youth can really inspire the grassroots involvement. So that's going on now and has been successful, and it's with 9 stores, so I'm anxious to go visit them myself. So from the most successful, if I was going to rate the most successful strategies using our review of the literature, the price interventions are easy to do and successful. You just need cash, because it's giving people incentives to buy the right foods. It's vouchers and gift cards and coupons and rebates, but those are successful. So to the extent that they can be used, it does change what people eat. Food access is successful. There's many programs for the elderly and for certain groups that have some home delivery of free or lower cost foods, and those will change what people eat. So just clear cut. And then the comprehensive store-based interventions that I just described, that's the third one. So all 3 of those were shown to be the most effective in the retail world. So the second area is improving access to healthy and decreasing access to less healthy food and beverages in food programs. So we've worked a lot with that, with school meals, showing if we change the guidelines in the state of California that kids will eat differently, and then we evaluate how they're eating afterwards, and then, can move on. In the child care, for example, we worked with child care providers and developed a healthy beverage policy in California and linked it to licensing. And then we turned around and evaluated it to see how it was working, and we found out it wasn't working very well, that people didn't know about it. And so then the next thing we did was work with the institutions above, the Department of Education, to actually get them to come up with some money to put it into the training for childcare workers, so at least they know that that program existed. But when you do have it implemented properly and with some fidelity to the intent, then it was very successful. I mean, it was changing the beverages. We did a survey and found out, how much it changed the beverages of the children. So those are effective. Food bank is the one that I wanted to cover today because it's one that we don't think of as much, and it's critically important because it's serving a target population with great need. And in the United States, it reaches a great number of our families. I think it's like 1/6 or 1/7 of the population is served in food programs. 50 million people in the U.S. rely on the charitable food programs. And those are the programs that use donations and government foods and distribute them through food banks to pantries and soup kitchens and shelters. So it's a very robust system in the United States. And the Feeding America network includes most of the programs and kind of unifies them. It's their organization. 200 food banks belong in 60,000 food pantries. And their mission is to feed America's hungry through a nationwide network of food banks and to engage in this fight to end hunger. So remember that, because I'm going to come back to it in about 6 slides. So it's to feed America's hungry. That is the mission of Feeding America. However, very poor households are at the greatest risk, for poor health. So people who go to food pantries have a 50% greater risk of diabetes, and they have a 20% greater risk of high blood pressure. So when you put 2 and 2 together, you can see that the food that they're picking up at the pantry can make a big difference for this particular population. And so in early 2000s, we got wind of a food bank director it was the Central Food Bank of New York, who was really interested in doing a nutrition policy. But he was scoffed at by his peers, the other leaders in the food bank, who suggested that, I skipped ahead to show you how poor their diet is, and I'm not handling my equipment very well, sorry about that. So their diet is too high in fat, calories, salt, and sugar, and I'm coming back to the New York in just a moment. So it's hunger alleviation versus health promotion that he was striving for. And he said that, he would like to, limit the unhealthy foods, but his colleagues in other food banks said that people should have free choice. This is a hunger alleviation program. So he suggested that what he really wanted was he wanted to survey his clientele at the various food pantries and find out what they really wanted. Because he said, I can argue all day with other food bank directors, and they say, that I'm taking away people's free choice. So we did that study for him. And we found out, just as he knew his clients, that we ranked people's preferences. And we found the lower ones, the meat, poultry, fish, and vegetables, are the highest ranked. The lowest numbers are the highest ranked. I should change this chart because it's kind of counterintuitive, but that was the ranking scores that we used, so we just kept them and put them right on the slide. So the high numbers are those that are ranked as foods that are not needed or wanted. And the highest ones were soda and candy. So he was right on the button. He knew his people. They didn't want that. They wanted meat, poultry, fish, vegetables, fruit, eggs, milk, bread, in that order. So we published the paper, and he carried it to the next big national food bank meeting and said, you just tell me who's right on this. So he had one of the earliest no soda, no candy policies. And this led to a reduction of 65,000 pounds of soda received at the food bank and distributed to pantries in 1 year post-policy. This policy action took out of circulation 13.7 million calories, potentially preventing, he wanted how many pounds of weight people might have gained, 4,000 pounds. I mean, he knew how to market his nutrition policy. So, potentially preventing 4,000 pounds of weight gain by doing that. And it was very well received by the clientele. They really did he worked very hard to bring in more fruits and vegetables and the kinds of things that they wanted. So we went on to develop a free course online called How to Create Food Bank Nutrition Policies. And Kaiser Permanente, one of our health organizations, funded it because they felt that it was very important that other food banks who would be interested in this would know how to do it and the barriers and the way to do it efficiently. So the next thing we did was we worked with 6 food banks in California that adopted nutrition policies. And in 3 years, with a lot of resource help, they managed to increase their offerings to participants by 10 million pounds of vegetables and fruits over the next 3 years. So they really figured out how to work with the farmers nearby and to get products that were otherwise going to be wasted and how to, maneuver and work the system to get the healthiest food possible. So this is really such a great example of kind of connecting the dots that dietary intake is associated with health. These individuals really have problems, especially with diabetes. And just one emergency room visit for low blood sugar costs over $1,400. And so the cost of low-cost food for a month is less than a sixth of this. It's a very cost-effective approach. And Hilary Seligman, who is now working with Feeding America, has just published a paper on how food pantry really worked hard to address the needs of their diabetic patients and how they really improved their diabetic markers with the food. Even though this is not the majority of the diet, this is an important piece of the diet, and it's an educational. For all of the work that we do in policy, there has to be an educational component, and this educational component that is linked with the foods that they're getting has really changed their life. So we can see that this is a very effective way to change what people are eating. And this year, there is a new goal for Feeding America. It's always been a hunger program. And this year, their goal is by 2025, Feeding America, in collaboration with the network and partners, will ensure access to enough nutritious food for people struggling with hunger and make meaningful progress to ending hunger. So this has just been a movement, and I wanted to share with you, a lot of people haven't been involved in it, but wherever, you can find a wedge to help make these changes, because there's still lots of food banks that need, kind of support to take this action. But I will say there is a real movement going on right now in the charitable food distribution. So the third and final way then is reducing access to less healthy foods and beverages through the use of economic means or taxation. So this is during this unprecedented time increase in obesity, which you've now seen from 3 different speakers. There were lots and lots of studies. It's almost a tsunami of studies that were happening in the literature about the time when that obesity epidemic was just rising up in the 90s and after. And so there were so many studies that I just started listing a few of the really important ones, and I'll just mention a couple of them. One is on our better understanding, which came in the 1990s, of how beverages are different from candy. They're different from other sweetened products. That energy from liquid sugar was found to add to and not displace other forms of energy. Liquid sugar has poorer compensation of calories. So it means if you're going to eat something before lunch, if you have a sweetened beverage, you'll only eat about 9% fewer calories for your lunch if you had a sweetened beverage before lunch. But if you have granola bars or something, you'll compensate for about 64% of the calories in your lunch. You'll eat less lunch having had a snack right before your lunch. So that was very important because it helped us better understand this important mechanism of why sugary beverages can be so problematic. But during this time, we watched the sweetened beverages rise. We watched milk go down. We worked on a CDC-commissioned evidence review, a systematic review of the dietary influences on obesity with 15 other universities and health departments. And we looked at 28 different dietary factors, and the association between sugar-sweetened beverages and obesity was stronger than that observed with the other dietary factors. So this influenced CDC funding, it influenced local health departments, it influenced state health departments. Our state health department is still working on soda issues based on this, and there's been so much that's happened since that. In the next decade, there was more work on NHANES data showing the relationship. There's longitudinal studies, there were cross-sectional, there's observational studies. One that got a lot of press is that in an 18-month observational study of middle school youth, the risk of overweight increased by 60% for each additional serving of sweetened beverages. And that came from Ludwig at Harvard and really was very important in people understanding that there was a real risk. Another one that I find really interesting that people don't seem to know about is in the large women's health study, women who drank 1 or more cans of soda a day were nearly twice as likely to develop type 2 diabetes as compared to those who rarely drank soda, like once a month or less. I mean, that's terribly important. And I don't think doctors, so this will lead in well for tomorrow's discussion, I don't think we're getting that message. And the same thing is true for these women. They had 23% higher risk for heart disease if they drank 1 soda a day. So we're not talking about any unusual amount. This is the American public drinks more than a soda a day in general. So this is a risk that, one really has to weigh. The longitudinal study that I worked on, we found a 2-fold increase in soda intake as children grew older, and it predicted BMI increase. One of the other pieces that hit the news was California became the first state to ban the sale of sugar-sweetened beverages in all public schools. And this was through the work of some legislators who were really involved in trying to better understand. They got those same pictures that Mary showed about those schools that look like junk food malls. I remember, when I went to speak with Senator Feinstein, who's still there after all these years, she, her staff, it was just kind of glazed over when I was telling him about the schools, that you wouldn't believe what our schools look like. We have to do something. And you could see it wasn't a high priority for them. And then I just pulled out one picture that looked like, a mall. And she said, well, that's not a school. And I said, well, yeah, that is. And she said, well, I don't remember anything that looked like that. Her staff was maybe 35 or 40. And I said, no, that's a school right now in California. And so a picture is worth a lot of words. And so this, we did some research to support this, and then we evaluated it afterwards. And we also wrote a paper with the obesity stats in the state of California. The slope of the line changed after this policy was put in place. So the slope of BMI change in California changed and we can't say it was as a result of this because it just happened coincidentally. And we don't know why the slope, because there's no cause and effect. But it certainly appeared that this made a difference. And then when we studied to see if children really compensated and had more sugar-sweetened beverages before and after school, as the industry suggested that might be the case, we found that that they did have slightly more, but not nearly as much as when they could buy sodas in school. So all of these things led to people deciding that a tax may be the way to go. That economic interventions are among the strongest of interventions that we can use. Sodas are the single greatest source of added sugar in the diet. There's poor calorie compensation, and then there's poof of harm that was established. There's minus an R. That was a typo. But this is an interesting one. This is a chart from one of Kelly Brownell's papers that shows the relative price changes in food groups. So during the period when obesity was climbing, and the consumer price index for food, was climbing as well, lots of the foods were increasing in price, that carbonated beverages weren't keeping up, which meant that they were more reasonable and could be purchased, by those who had less money. So this is going on during that period. And at the same time, we looked at the elasticity estimates when we were thinking about taxes and realized that from all the studies from this that had been put together by Andreeva, that soft drinks and food away from home were more elastic, and juice too, than all of the foods at the bottom of the chart, the eggs and sweets and cheese and fish and vegetables. So that if money is short, if the price is raised on a product and you don't have enough, or you are not sure if you want to pay that higher price, that you are less likely to make that decision to purchase it with soft drinks, juice, and food away from home than you are from eggs or the things at the bottom of the list. So there's lots of reasons why a sugar sweetened beverage tax may make sense. And sure enough, we looked at the different places where taxes have been implemented, and I was very surprised at how many taxes had been implemented prior to the big news in the United States when Berkeley passed the first soda tax. The Navajo Nation had already passed a soda tax, and many countries had already passed the soda tax. Finland, Norway, and Samoa were very early, and I put double stars by them and Fiji and the Philippines, because then they've gone forward and increased and changed their tax over the years going forward, but I didn't want to list them twice. So there really are quite a few countries who are using it for various purposes. I'm more familiar with the cities, which are at the bottom of 2014, 17, and 18, and how they're using the money. And it's different for every soda tax. In Berkeley, I'm on it's called the panel of experts, and we get to decide where the money goes. And what Berkeley has decided is to use it to try to reduce disparities in diabetes. So that money is really going into the community where diabetes is the highest. And so their community groups apply for grants, and they're doing lots of work. So we haven't looked at diabetes yet, but we're certainly in the community, and people know what their money is going for. Others, like Philadelphia, I think they're using it for preschool, and different ones are using it for different purposes. But let's look at the outcomes, because now we have 3 good studies to really show whether they work or whether they don't. So Mexico's, that was one of the earliest ones that has been really evaluated, that using purchase receipts, they found that taxed beverages decreased by 8.2% over a 2-year period. And interestingly, the lowest socioeconomic group had the largest decreases in both years. So this was really welcome news, because that is where the diabetes and obesity and the highest intake is happening. And then untaxed beverages increased by 2.1%. And then Berkeley's soda tax had kind of similar results. This is from a survey, however, that consumption of SSBs decreased by 21% in the intervention city, Berkeley, and increased by 4% in the nearby comparison cities. Water consumption increased by 19% more in Berkeley than in their other cities. So Berkeley Jen Falby did this study with interviews in the lowest income part of Berkeley to see what was happening in that area, because that was our goal, was to change disparities. And then Lynn Silver did a study using grocery receipts in 2 large chains, and she did it in 3 cities, and she found with Berkeley's that the sales actually fell by 9.6% for the taxed beverages. Untaxed beverages rose by 3.5%. And consumer spending by transaction did not increase, nor did store revenue fall. Those were 2 things that people were concerned about. Water consumption increased by 19% more in Berkeley. And interestingly, it was 19% on the interview. That is not likely to be 19% in both, and it isn't. This should be an upside down 9. It should be 16%. Water consumption increased by 16% more in Berkeley, and in the last slide it was 19%. So actually the 2 studies, it does make an interesting comparison doing the surveys as well as the grocery receipts. And then finally in Philadelphia, they did some surveys on the phone, and they found that the reported daily consumption of soda was 40% lower, energy drinks were 64% lower, and bottled water was 58% higher. And I understand, did anybody go to the obesity meeting and hear Sarah Bleich present? I think she said, I got it all by secondhand, I think using grocery receipts, that the daily consumption of sugar-sweetened beverages was down even more. I think it was I'll double check. It's over 50%. So Philadelphia has shown the biggest change, and she's working on a paper right now, so we will get the exact number and the details. But just know it's even higher than the phone interview indicated. So we've had 3 different soda taxes that have had extensive evaluations. And so far, we're finding that this is an effective way to change beverage consumption. I can't think of any other way we could change population consumption of a food or beverage item in a way that would produce higher results than this method, this economic method. So the next steps. Communities are looking to beverage taxes to reduce the consumption of SSBs in their population, to increase awareness of health risks. The Berkeley soda tax is certainly used we've done media campaigns so people know what is happening with their tax dollars. Reduce healthcare costs. We hope that's an outcome. Raise funds for health education or other purposes. And then the beverage industry is working to handle the effects of these community tax efforts, is making changes in product formulation, and that's very good. That's one of the outcomes that I think Mary had talked about earlier, is that's a real byproduct of labeling laws too, that companies can change the formulation when there's a particular effort going on that highlights some of its ingredients, is diversifying product offerings, perhaps. And then I have an addendum to this slide. So I'd like to end with a little story of what happened last June in the state of California. I don't know if any of you heard about it, but there was an initiative on the ballot. The beverage industry and grocers had gotten together and put an initiative, got signatures. They spent $7 million getting signatures to put an initiative on the ballot for November that said that any tax in a local community in California that would be put on by initiative, and California is an initiative state, that's how we move a lot of, that's how we actually govern in a lot of instances, would need a 2/3 vote to pass. So the mayors of the towns in California were up in arms saying, you can't do this. This is for firemen retirement benefits. This is for street Potholes, we can't have a 2/3 majority for every tax we put on the, as an initiative on the ballot. And the folks putting that on the ballot said that, well, we'll take it off the ballot if the legislature votes within 1 week. This was a 1-week period. I was preparing an op-ed, and it went through the budget committee, and then it went through the legislature, and then it went through another committee, and then the governor signed it in 4 days. So this was really a very unusual. We've never had anything like this where they really were holding the legislators hostage and saying, if you don't sign a new piece of legislation that says no new taxes for local communities on food or beverage for 12 years. So that is a piece of legislation that has now been signed by the governor. We can have no taxes, no beverage taxes is the primary one that, I'm not even sure how the food one is written. The beverage one, no new taxes for 12 years. So everybody was up in arms and said, this is not right. I mean, this is the right to govern for a little city, a town. We had lots of cities and towns that were working on, some soda tax effort and were quite a ways along, actually. And so they went to, during the time of this decision, people went and testified to the legislature to no avail because it was signed and passed. But I wanted to share with you a couple of the testimonies because I think people have to realize that there's only so far you can push people about it. People want local control. And here
Hi everyone, my name is Ashley
here's
Vasquez.
a girl,
I'm
a
also
teenager.
opposed to this bill. I'm from Stockton, California with the Less Soda, Better Health project. I come to you all today heartbroken. When I heard about this bill, I was in complete disbelief. I've been working on the Less Soda, Better Health for a year, and our goal was to educate our community about diabetes in order to help make Stockton healthier. And during this project, I met so many incredible people with incredible stories. I've heard about people losing loved ones over this disease, or of kids who are forced at young ages to take care of their parents because of amputations or other complications. I've seen kids like my sister who at 4 years old, she had to get all her teeth pulled out because my parents didn't know that drinking juice was harmful. And I mean, can you really blame them? It's our duty as a society to help each other out, and that includes education and projects like these. Even with these stories, I've learned that there's so much hope in the community. People want to change, they want to be better, sometimes they just don't know how. We were giving people that knowledge that they needed. We were giving them solutions to be healthier, and the American Beverage Association is taking away our right to offer these solutions, and it's taking away the creativity from young people like me who want to make a change in their communities. They're taking away not only our voices, but also our right to vote, because we don't get an option of choosing if we want this, and you know what, we don't want this. And so I ask you all to please don't sign this, and stand with us, the community members. People's health is way more important than corporate wealth. Thank you.
Yeah.
Well,
I'll do
I'd like
one
to
more,
say
then we'll.
hello, everyone. It's a pleasure to be here talking to all of you. So my name is Diego Villanueva. I'm from Stockton. I'm recently turned 16, and I've lived there my entire life. So while giving this speech, I'd just be honored if we could all raise our hands if you know someone who has diabetes, just everyone in the audience, and if you would like to stand with me in the opposition of this bill. So if you're not raising your hand right now, I'd like to say that you're very lucky, because given the statistics that we've all heard already, diabetes is a huge issue. So you can't argue that diabetes and obesity aren't a problem in the United States. Why not work towards diabetes prevention and follow in the footsteps of cities like Berkeley, Oakland, San Francisco, and Albany? Stockton is known as ghetto and is known for homeless. Ever since the Stockton bankruptcy, where have our programs gone? I've spent summers doing nothing, sitting at home. I might as well be drinking bottles of the cheapest vodka I can find, as that's the image that's painted of me when someone thinks of our city from a negative perspective. This is why I've been a part of a movement in Stockton to improve my community and make it a better place to live. the Less Soda Better Health Project, as we're all wearing these shirts. Instead of growing up thinking, we're so unfortunate to have been born in Stockton, there's a hope that comes through community organizing. This comes with finding funding, because we already know money leads to change, as we've seen how rapidly the American Beverage Association has come up with legislation from behind the scenes to put an end to any fee that would hurt their profits. The American Beverage Association could use this money for positive change to help communities who are becoming increasingly devastated by diabetes, which leads to thousands of amputations, ridiculous costs for those with the disease, and enough shock to inspire community organization to prevent the disease. In Stockton, we want health education. We want nutrition education. We want diabetes prevention. And we aren't going to have the people have their voices taken away to ask for these programs. These aren't just desires that we've come up with on our own, because we've been surveying people, and these are the kind of things that they want in our community. Please don't agree with this bill.
Okay, so I think we all have to be really aware that there's a movement. I mean, people want to have their health. This is a very poor community, and these kids, I mean, they've seen too much diabetes. So it's a little, I think it's too late to really think about these kinds of preemption things at the beverage industry. They now have 3 states where they've preempted and done what they've done in California. So, and there are more that they're working on right now. So I think we all have to be really aware that there is, you know, a real grassroots movement for health. So I hope you'll have some questions and I can answer them, and thank you very much.